CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
Hi, everyone. Welcome to the CURES Show, where we explore the cutting edge of wellness for our mind, body, and spirit. Nearly 2 million women will go through menopause every year, and of course, perimenopause happens about 10 years before that. It is a transformative time for women that's really not talked about enough. It comes with what I'll call the trifecta of trouble: weight gain, mood changes, and sleep issues. Dr. Jennifer Stagg is here with some of the best supplements that can support women, because we really don't have to suffer. We know so much more. I'm so happy we're talking about it more. So thank you for being here.
Yeah, thanks for having me. It is it's such an important topic, and I hear about this all the time in my practice, women coming in and they're learning a lot online. There's a lot of information out there, and then of course they're like, oh, what do I do with all of this? So,
yes,
right?
It can be overwhelming. In fact, just recently, I want to refer people back to a different CURES show. We interviewed the producer of the new movie M Factor, which is actually continuing education credits for doctors, because there's really, not you, but others, there's a lack of knowledge, right? I mean, you're a functional doctor. Others who came from an MD practice, my understanding is a lot of doctors didn't spend much time learning about menopause or how it would really affect women across their lifespan.
Right, and I hear this routinely from my colleagues who were trained, conventionally OBGYN, and they total lack of training and education around menopause treatment.
Yeah. So we're going to talk about, I said, the trifecta of trouble. This is in my group text with all my friends. Everyone's like, oh, this, everyone has different issues. It seems like some of the big ones, which your group does, because supplements can make a difference, like a lot.
Oh, yeah.
Mood problems, weight gain, and sleep issues. So let's start with the weight gain. That seems to be an issue. I mean, it seems like you're eating the same stuff, and all of a sudden you just are gaining weight, especially around the middle.
Yep, exactly. And so those changing estrogen levels are contributing to that, along with some other changes in hormones. So we'll see changes in things like leptin and adiponectin and some of these gut hormones that affect our general metabolism. And so just the product of aging too is underlying some of this too.
Okay.
So there's the estrogen for women, but also for men, it's just an aging process too that affects our metabolic rate.
Like we just become a little bit more insulin resistant.
Yes.
We don't burn as many calories. We just can't eat as many carbs.
Exactly. And some of those signals of inflammation, oxidative stress, that's this whole concept of inflammaging or oxy-aging. There's a couple of different terms describing these changes that happen as we age. And then when you have declining estrogen and progesterone levels on top of that, that creates even more inflammation, because our natural estrogen is anti-inflammatory, basically.
Okay.
Yeah. So a lot of this does come down to that, and that's why using certain supplements can really help with some of these changes that women are experiencing.
Okay, I want to get into some of the supplements that can really help with the weight challenges, but a lot of talk about hormone replacement therapy. As a naturopathic doctor, as a functional doctor, so many people are confused. You actually think the research is good on taking HRT?
Yeah, I think so. The evidence really looks completely different than what it looked like 20 years ago. And so in the last 2 years, the landscape has really changed quite a bit in terms of articles that have been published, really large scale studies. And so I think we can safely recommend hormone replacement bioidentical to most women who are going through menopause, but it doesn't solve everything. So you
can't just take your estradiol patch and then be like, I'm not going to gain any more weight. I can eat what I want. It doesn't work that way?
Pretty much it doesn't work that way. I mean, so I have women come in and yes, they go on hormones and it's a 180, they are seeing big changes in things like hot flashes. Their sleep maybe improves as well, a little bit of brain fog. I've had some women who have had really, tremendous turnarounds, but then there's plenty of women who the hot flashes go away, but they're still stuck with some of these other symptoms, right?
Yeah. So, okay, well, before we even get to I know we're going to get to the weight loss, but before we get to that, you mentioned hot flashes. women don't have to suffer. I mean, I feel like my mother and mother-in-laws are talking about hot flashes for decades, and that's all anyone ever knew about menopause.
Yeah.
That's really just the tip of the iceberg. But you do have a supplement that really helps women, whether they're taking hormones or not.
Yeah, so for years, this is what we used before the new research on hormones, where a lot of women were choosing not to go on hormones, and their doctors were, not recommending they go on hormones. And still, we have women who, are still on the fence. They're not sure. So,
Estravera by Metagenics. What is this?
So this is Siberian rhubarb. So this is what we call a phytoestrogen. So this is a plant that weakly binds the estrogen receptors, and that can be enough. This has actually been clinically studied, and it reduces the main symptoms of menopause, like hot flashes.
Okay, so this is by Metagenics, which is a clinical grade supplement. However, if you don't get an appointment with someone like yourself, you can still get this. You will find this online at metagenics.com.
Right. And you would want to order direct from the manufacturer. Don't order it from some independent, third party.
Yeah.
You can order directly from the manufacturer, and then that will assure you're getting the actual product. And there's no fraud. Unfortunately, there's a lot of supplement fraud in the industry.
Oh, gosh.
Yeah.
So everything that you're going to show us is over the counter, but yet has clinical research behind it.
Yeah.
So let's, beyond that, let's start with the weight gain. And this is berberine, which I'm taking myself.
Yeah.
I do notice, I think it does make me less shaky. I think I just don't, when I remember to take it or don't run out, I notice a difference. I'm not craving things as much. So this is like nature's Ozempic?
Yeah, basically. It does affect the hormone similarly to Ozempic affects something called GLP-1. So it does have an impact there, but it has a whole other host of other impacts. It is anti-inflammatory. It's an antioxidant. It affects your microbiome in a positive way. It's good for your liver as well. And it has been clinically studied, numerous studies, and actually comparing it side by side to a diabetes medication called metformin, and milligram per milligram, it performs the same.
Okay.
Now, what we're finding in our practice, so we don't you don't have to be diabetic or even pre-diabetic to go on this product and see results with it. I have plenty of patients that we're using that have just elevated insulin levels.
Which is what I have, I guess.
Exactly.
And I'll share that
So
with the
you're not-
audience. I did a blood test. Well, a lot of doctors don't even test your insulin resistance. That's a
Yes.
special test.
Yeah.
Different than what you normally, and it showed that I'm a little insulin resistant.
Exactly, yeah, and berberine will really help with that. And so we are dosing it a lot higher. So typically it'll come in a 500 milligram capsule. So we're at least doing 1,000 twice a day, if not a little bit higher in some patients to see results.
So that means 2 in the morning and 2 at night. And then do you take it forever, or how long do you stay on this stuff?
You take it for a good amount of time, and then maybe you can reduce it for maintenance. But yeah, it is something, it doesn't have to be forever, but if you're getting your fat mass reduced, because that's the whole thing, if we can get rid of some of that fat that sits around your midsection, that's where a lot of these signals of inflammation are coming from. And that's why we can't, really effectively get control of insulin signaling unless you get rid of the fat mass. So once you get rid of it, you can oftentimes decrease your dose on these things.
Okay, so you need to lose the weight, because once the fat is gone, you'll be less insulin resistant.
Exactly.
And the insulin resistance, if people are going, what does that matter? Insulin is a hormone that affects our metabolism, and if it's not working right, we tend to put on weight.
Exactly. It'll cause you to gain more fat. You basically will store more fat in your cells, and you'll have just more systemic inflammation.
Okay.
And that's obviously bad for weight.
If you don't have that blood test and you don't know if you're insulin resistant, can you still benefit from the berberine?
Yeah, for sure. Because most people, and even sometimes just a standard insulin test might not pick it up completely. We might have to do something called an insulin resistance score, which is an algorithm where we're looking at 2 different compounds, C-peptide and insulin, and then sometimes that will reveal it. So even if you've had a normal insulin test and the insulin value that's reported on a standard lab test is too high, it's 17 is what, and so if you get a test back and it's 12, your doctor will say it's fine, but it's not fine. It needs to actually be under 5.
Under 5.
Yeah.
By what?
For a functional.
For a functional
functionally.
doctor. Yeah, because I think mine was at
actually work.
11, and so a regular doc would say you're fine.
Yep.
But you would say that's part of the reason maybe why, if I was eating a normal amount of carbs, I still felt like I would retain them.
Exactly.
Okay, so let's go on with the weight gain. Creatine. This is something I associate with bodybuilders, but we're seeing a lot more all over. If you're watching Instagram, I know my kids like it. People are talking about creatine as a daily supplement, even if you're not one of those bodybuilders.
Yeah, exactly. So it's an amino acid blend that fuels your muscle cells. So it's something that gets like stored in your muscle, and we use it to produce energy. ATP is what the whole like mechanism of how creatine works. And that can allow us to maintain a healthier muscle mass. And there's also some research showing that it can help with some cognitive symptoms that, of course, are part of that wonderful perimenopause, menopause this group of symptoms.
Yeah.
And so women especially can benefit from that, because as we age, if our muscle tends to decrease, right? We can be more prone to having muscle loss or wasting, and creatine can help sort of mitigate some of that. But also, obviously, if you're doing some exercise along with it, especially weight-bearing exercise, resistance training, you're going to get even better results with it.
And that's something else that's changed, I think, is that it used to be we talked about eating very little, doing lots of cardio. Not that that's not still important, but the focus seems to be everybody, everywhere we turn, is talking about eat a lot of protein. You got to help your muscle. Is that what this does? It helps your muscle? And what's your thought on making sure we eat all this protein?
Yeah, so I think for some people, they're going over and above the amount of protein that they need, certainly. Like, there is a lot of emphasis on very high levels of protein, and I'm seeing patients that are just eating like more than they really need to eat. And
so calories
that come along with that. Yeah.
Okay.
Yeah.
All right, so you want to be eating protein at least at every meal.
Yes.
And when you say no carbs, you're not saying, if we're trying to do the berberine and we want to lose the fat, you're not saying no carbs. You're saying we should have some fruit, maybe a little bit of starchy vegetable, just not the bready kind, not the flour kind.
Not the really processed carbohydrates. So the stuff with flour in it, with added sugars, processed sugars, artificial sugars are like even worse for us. It affects our gut microbiome, and we know there's a lot of really important sort of factors there related to weight management too.
Okay, so you would recommend we have fruit every day?
Yeah, so you can eat, and we want to have more lower glycemic types of fruit, so berries, green apples, small servings of melon, like those are all fine.
Melons are not high glycemic?
Yeah, so like a honeydew melon is pretty low glycemic. Cantaloupe is pretty low glycemic. Bananas you want to avoid.
Avoid bananas. Avoid carrots.
Carrot, you can eat a little bit of carrots,
okay,
but like, you know, you wouldn't want to go over like a full carrot basically.
One carrot. Okay. One carrot. But I mean, this is important because, you know, what people may not realize is that you posted something the other day when they were there was the author of the big book Good Energy right now was talking about how she never learned any of this in med school. And you're saying, in fact, functional doctors, naturopathic doctors did learn all about med school, was all about diet, prevention, you know, treating these types of things, insulin resistance, metabolic diseases, with foods and supplements.
Yes, like at a core, because you can take hormones, but if you're not addressing your diet, lifestyle, stress, the chemicals in our environment, which are just wreaking havoc on our gut and our hormones, then you're just not going to like get the results you're really looking for.
Okay. Yeah. And speaking of results, you have a patient who's was plateauing, and then they started taking the 2,000 milligrams of berberine, which this is biotics. You like biotics.
Yep.
2 in the morning, 2 at night, and they just all of a sudden started losing.
Yeah, they started losing weight. And this is a woman over 60, and she has lost like 7 pounds now. And really the only change she made was adding a higher dose of berberine.
But don't take your berberine and then go get Chick-fil-A.
But she's also eating really healthfully, right? Like, she does do the work, and it just wasn't adding up for her.
It wasn't adding. And that's what I think a lot of people, I think I eat pretty clean. But like, you know, every now and then you have a little something or a little this, and you're like, wow, it just comes right back. So this is the problem where as we get older, our metabolism may not be firing the way it should.
Exactly.
That's why we would do a supplement.
Absolutely.
Not so we can eat Chick-fil-A with our kids.
Exactly.
Okay. Okay. So this is also standard process, great brand. You might be known about this. You can see it online. I know you sell it at your Whole Health Wellness in Farmington. This is a detox balance. Why does detoxing matter for weight loss?
Yeah, so, and especially for hormones. So our hormones that we make naturally, or if you're taking hormones, those will get metabolized through your liver. And as we get older, our like detoxification processes, just like our general metabolism, gets a little bit more sluggish. And then also we've just had a lifetime of accumulating toxins as well as stress. That's the other thing I say. If we went through menopause when we were 20, we probably wouldn't have the experience that we have when we're 50.
Okay.
Because of all that, like
the stress is a big deal.
And environmental exposures. But when we support those detox pathways, then we can see improvements in like hormonal balance, the receptors. That's another thing we don't hear much about, is that estrogen receptors sort of need to be like clear. So those estrogen receptors can be bound up by environmental chemicals.
Oh, so you need the detox to clean off your estrogen receptors. Yeah. So you got to clean out the gunk. You're basically
You're
cleaning the inside so everything works better.
Yeah, so the hormones
that makes sense.
Better. Yeah.
So how would you take this, and how would you take the creatine?
Yeah, so something like this detox balance, a lot of times what we do is we would put someone on more of an intensive detox where they're doing 10 or 28 days with a higher dose of this. And then you could be, depending on the person, we might have them on some maintenance dosing with that, where they're doing like a half a serving a day just to keep everything like clean and flushing through. You can add creatine straight up to a protein supplement. So like this clean creatine that we have, I will add this to my protein shake daily. So I do protein and collagen, and I put the creatine straight in there with it.
Okay, in your shake. So I'm putting collagen in my coffee, the vital nutrients.
Yeah.
Are we okay with that?
Yeah.
Okay. And then clean creatine, if you're going to have it, you can just put it in water. Yeah. Even on a day you're not working out, we should take it every day?
That's another thing, is that a lot of times from that bodybuilder perspective, people are in this mindset of like high dosing creatine, you have to do these loading doses, and you need to just do it around exercise. But for what we're talking about here, that's completely unnecessary. You just dose a daily smaller dosing, just like 5 grams is what this one is.
Like a scoop.
Yep.
Okay.
Yep.
Okay, so all these things, people don't, I know they don't want to buy, they don't want to take too many things. You wanted this, you wanted that. Depends on what your issue is. If you were to start with one thing to move the needle in weight loss, what would you choose?
I probably would do berberine.
Berberine.
Yeah.
Okay. And start at 1,000 or start at 2,000 milligrams?
I probably would give it a go with 1,000 twice a day, like with a meal.
Okay.
Yeah.
So you take it either right before you eat or during the meal?
Just as long as it's with that meal.
Okay. So now we're going to move on, and this is more about mood. We have some things on the table for the middle. We talked about Estravera for hot flashes, but then mood, I think for some people, is their biggest issue. I was talking to one of my friends, and she said, well, I'm already on an SSRI. I've kind of always been anxious, or I've always been a little moody, but it's just way worse. So it's hard to know if that's from these perimenopause, menopause, or it's just the stress of raising kids, or but how do we know if mood is really related to our hormones? Yeah,
so we know. I mean, like women know, like there are changes as we have, like when we're regularly cycling, you can have mood changes that come with PMS, right, around your period, and those are clearly recognized as hormonal. So the same thing is happening as we transition through menopause and in perimenopause. We're having these fluctuations in hormones, declining levels, especially of progesterone, can make us feel a little bit more anxious and irritable. And so, like when you add those hormones in terms of hormone replacement, yes, many women will find that they feel a lot better, but some don't feel completely better. And then there are other options like safe add-ons that we can do. Again, we're thinking about things that maybe regulate how hormones get processed a little bit better. So
even if you're doing HRT, you can take some of what you're about to show us.
Yeah. Okay. So this is where we would think about another thing that happens is this oxidative stress and cognitive changes, right? Where women are like, I can't remember a name. They're trying to get this like
that brain fog can be a huge symptom.
That can be a big issue. So when we think about that first, we think about this concept of oxidative stress. So this is where I would think about something like liposomal glutathione. And glutathione is the master antioxidant that we produce naturally in our bodies. But some people have genetics where they don't do a really good job of producing this. Some people, there under a lot more oxidative stress, maybe from like actual emotional stress that they're going through can cause that, but also just like chemicals in the environment. Their diets might be lacking like antioxidants, or the diet itself is more like inflammatory, and that can cause that. So this can be really particularly great for women who are having brain fog and irritability.
Okay.
And so that's what I really like to use there.
How do you know if it's working? How do you take it and how long until you see a difference?
So we tend to see, like, with supplements, it's not always, overnight. Yes, there are some supplements that I have women and men for other things reporting like, oh my God, I took one dose of this and I feel different. So that's entirely possible. With something like liposomal glutathione, this is also something we use quite a bit post-COVID for brain fog and for long COVID symptoms. And I've seen amazing results with this pretty quickly. So
Okay.
a lot of times
How do
this
you
can be
dose it?
within a week or two.
Week or two. Okay.
I would dose that I would start out with 2 capsules a day. Depends on what like severity level we're dealing with and what we're treating, but I would do 2 a day. The thing about glutathione is that you can get a glutathione most glutathione capsules are not liposomal. This is a dry liposome, so it's kind of hard to find that. So this one's dry and in a capsule form. Most of the other liposomal glutathiones are a liquid, it tastes a little funky because there's sulfur in glutathione. So it's exciting to have like a capsule version of it.
All right, so this is your own private label, Whole Health Wellness, but if people go to wholehealthwellness.com, can they get access to these?
Yep,
okay.
Yeah, we have a store.
Okay, so this is another one, Designs for Health, local Connecticut company, but FemGuard Balance supports healthy female hormonal balance.
Yeah, so this is something that we use quite a bit, especially for women who are having like exaggerated PMS. So this is really great, and I would say more so in perimenopause, and especially if women are not on hormones yet. That works really well.
Okay.
And you would just, it's a blend of some different nutrients that support the detox pathway. So in the liver, so things like DIM, broccoli, there's some chase tree berry in there, or vitex it's sometimes called, and that really helps kind of regulate that whole hormone axis.
Okay, and I do want to make sure we get to sleep because that's a big issue, but Lavella, this is, I know that you've put some people I know on this who are really struggling with anxiety, irritability, clinically studied lavender oil by Integrative Therapeutics.
Yeah.
This really helps people with anxiety.
It does. It can help with depression as well, but for anxiety, this is my go-to first thing that I'll typically recommend, and it works pretty quickly, I would say. It has been clinically studied and compared side by side to SSRIs. It's a German product. It's a very concentrated extract of lavender, and it has shown to be just as effective as an SSRI without the risk of side effects. It works a little bit differently than the SSRI, so even when I have patients who are on like Zoloft or one of these common antidepressants that are also used for anxiety, we can safely use this as well.
Oh, you can use it.
On top of it,
where 5-HTP and stuff you can't.
Exactly, yeah.
Okay, we're going to hear a quick, brief word from our sponsor, and then we'll get back to what can help you with your sleep.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit wheelerhealth.org to learn more and take the first step towards recovery today.
Okay, we're back with the best supplements that can support women through the perimenopause and menopause years, which if you didn't know, perimenopause is 8 to 10 years before menopause. So basically we're talking about all of our 40s and 50s here. So a lot of folks. All right. Sleep is also, if you're not sleeping well, all the weight gain, mood issues, that's affected. And people will tell me all the time, they just accept that they don't sleep,
Right. It's terrible.
They're like, I'm just a, menopausal woman. I'm older. I don't sleep anymore.
Yeah.
I hear that all the time, like it's normal. It's not normal. We need to sleep.
Yeah, it's not normal. It's common though. Like some of the statistics are 60% of women over 40 will have problems sleeping, and that could be problems falling asleep, staying asleep, getting like good restorative sleep. And there are options. And so again, like even if you haven't went on hormones, this is something we need to address, and going on hormones sometimes doesn't
Doesn't help.
solve the sleep problems completely.
So we
right?
begin with magnesium glycinate. I have started taking this. I do think it's kind of a game changer. I can feel it making me tired, that and my nighty-night tea.
Yeah.
But magnesium glycinate.
Yeah, so super safe. That's often the first place that we start, because we like to start with the safest, most likely to work option. And magnesium is one of those. So we tend to use magnesium glycinate more so than the other forms of magnesium for sleep. But if you were to use a magnesium threonate or magtine, that gets really well absorbed, gets to the brain. Mag citrate, we kind of have to be a little bit careful with, because sometimes it can stimulate the bowel a little bit too much, and people can have loose stools with it. But we also, that's another thing that happens in menopause, is women will have sluggish bowel.
So
and
then
so
the citrate's
magnesium
not
could
bad.
be a good option. So I might use a citrate there. But this is 200 milligrams typically is kind of a starting dose that I would use for a patient. And then it doesn't if you were to take that in the morning, it's not going to make you sleepy.
It won't make you tired?
It's not a sedative. It just, if you line it up with when your bedtime is, it can help get you, your nervous system sort of calm down.
Okay, what about melatonin?
Yeah. So melatonin is another option. So that often we will use. Sometimes people are having problems falling asleep. As we get older, melatonin levels do decline, which is why it often works for many women. But sometimes women are having difficulty waking up throughout the night. They're having this restless night of sleep. And if you use more of a sustained release melatonin, so that's what this one is here, it'll sort of pulse out throughout the night, and then that could keep someone asleep. So it can help you get to sleep and stay asleep. And you don't know if it's going to work unless you try it, honestly.
What's the starting dose for melatonin?
So with this sustained release one, it's 6 milligrams, and I never have to use 2. So, if that doesn't work, that's not the right choice, basically. We would go
It's 6
move on to
milligrams for
something
2
else.
or 6 milligrams for
It's
1?
just 1. Yeah.
Okay.
Yeah.
I think I only take 3, and that's enough for me. So maybe, okay.
Yeah.
But MyoCalm, what's that?
Yeah, so MyoCalm is another really great supplement that we use for sleep. And this one contains a little bit of calcium and magnesium, but then it also has some sedative type herbs. So it has valerian, it has hops, it has lemon balm and passion flower in there. And so it's nice and relaxing for the nervous system. So especially when women are having trouble falling asleep, I have them take this an hour, sometimes even 2 hours before bed. But it also can help with that waking kind of profile as well.
I feel like I'm taking a lot of that stuff separately. My valerian tea and then but who knew? MyoCalm, it's all in there. It's okay. So the bottom line, as we have maybe just a minute left, this is these are all over the counter things. They're safe. Of course, you want to talk to your own doctor, but I think pretty much everything you showed us doesn't have a major counter action with other things you might be on. I think the bottom line is people are suffering and they don't have to be.
Yeah, absolutely. There are options, and if you've tried something and just one thing and it didn't work, it doesn't mean that's not going to work. Sometimes we do have to kind of experiment a little bit. And then also quality makes a big difference, because I have women that come in and they're like, oh, I tried that. And there are supplements, unfortunately, that don't even have what they say on the label or in the doses that are in there. So then when we try a good quality version of it,
good quality.
Yeah.
Okay. So definitely bookmark this episode. If you're watching on YouTube, save it. Leave us a comment. It helps. Subscribe to the podcast, but this is a good one to share with all of your girlfriends. Thank you, Dr. Stagg.
Thanks for having me.
That's CURES. Have a great day and be well.
CURES, sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.